Hello, my name is Imran and I will explain today about border control. I have four questions. The first question is the period of childhood. According to any other books, there are the uh, four periods, and some of books are the five periods. And there are first period is newborn. And during the first month of the life response, the newborn exhibit the automatic response to external stimuli. In other words, then newborn will turn hand toward your like if you touch his cheek, he will remove his hand like this, and if you touch that side, he will remove this side. And this is the age of the first month of the age. This newborn period will start. And next one is the infant, is the second one is infant. The infant develop new abilities quickly the first year of the life. At 3 to 6 months, an infant can control his head movement and bring his hand together. The and next one is the three one is the toddler, and this stage will start after the 1 year, 2 3 year. And this stage, the 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 toddler will start to learn to walk without any help. And he can step one block to other another, and he can walk without any help. And third one is the preschool. And this one also known as the pre-aldosterone stage. And in this between this age, the start is the 3 year to 5 year. In this age, the child will throw a ball overhead and skip and hop, stand on the 1 foot for the 10 second. And sign and symptom there is the cerebral palsy in we can find in this stage in school. And next one is the school age. The school age children are 6 to 12 year old. They are capable to conflict, independent, and they're responsible for the relationships, particularly the relationship with the friend and other same genders. And these are the five stages of the stages of the periods of childhood. And second question is the cerebral palsy, motility, statics. Cerebral palsy is a group of disorder that affect the movement and muscle tone or posture. It is caused by the damage that occur to the immature brain as it develops, most often before birth. And this is the symptom and appearing during the infant or preschool years. In general, cerebral palsy causes impaired movement associated with the abnormal reflexes and flopsiness and rigidity of the limb and trunk, abnormal posture. And the people with the cerebral palsy can have the problem swelling, or commonly have the muscle imbalance in which the eye don't focus on the same object. And these are the symptoms, sign and symptoms. And sign and symptoms is the vary greatly. The moment of coordination problem associated with the cerebral palsy include the variation of the muscle tone, such as the which if the stiff of the floppy, and lack of balance and muscle coordination, and tremor or involuntary movements, and slow writing movements. In these symptoms also we will show the learning difficulty with fine motor skills, such and the seizure will show in this. And causes of this palsy of the caused by the abnormality of the disruption of the brain development, or most often before the child is born. In many cases, cause isn't known as the factor lead the gene mutation, maternal infection that affect the developing fetus, and fetal stroke, disruption of the blood supply to the developing brain, and bleed into the brain in the womb of the newborns. These are the causes. And cerebral palsy, motility. And the people with the cerebral palsy may experience uncontrolled or unpredictable movement. Muscle can be stiff, weak, or tight, and in some cases the people have shaky movement or tremors. For example, the GERD disease, gastroesophageal reflux disease. This is the for example of the motility of the cerebral palsy. And second was the statistics of the cerebral palsy. About 7,64,000 children and adults currently have the cerebral palsy. About 50,000 children under age of 18 currently have cerebral palsy. about 2 or 3 children out of the every 1,000 have cerebral palsy in United States studies. And the next third question is about the dysplasia of the hip bone and rickets. Uh, the the dysplasia of hip bone and rickets. These are the two topics in third question. And the hip dysplasia is the medical term of medical term for a hip socket that doesn't fully cover the ball portion of the upper thigh bone, and this allow the hip joint to become partially or completely dislocated. Most people with the hip dysplasia are born with the condition. For example, doctor will check your baby was shine and hip dysplasia shortly after birth and during well baby visit. And if hip dysplasia is diagnosed early, infant and soft breast can usually correct this problem. And milder cases of dysplasia might not be start causing symptom until a person of the teenager or young adults. And the hip dysplasia can damage the cartilage lining the joint, and it can also hurt the soft cartilage, also known as the labrum also hurt the labrum that removes the socket portion of the hip joint. This is called hip lobal tear. In these are the symptom of the hip dysplasia. The teenager and young adults hip dysplasia can cause the painful complications such as the osteoarthritis or hip labral tears. This may cause the activity related ground pain. In some cases you might experience a sensation or instability of the hip, and these are the some causes hip causes by the hip dysplasia. At the birth time, the hip joint is made of the soft cartilage that gradually hardens into the bone. The ball and socket need to fit together well because they act as mold or for each other. If the ball isn't seated firmly into the socket will not fully form around the ball and will become too shallow. During the final month before birth, the space within the within the womb can become too crowded that the ball hip joint move out of the proper position, which result in the shallower socket factory that may reduce the amount of space in the womb, include the first pregnancy and large baby and breech presentation. And in the third question, next topic is the rickets. Ricket is the softening and weakening of bone in children, usually because of the extreme and prolonged vitamin D deficiency, and it is a rare inherited problem, also can cause the rickets. And vitamin D help your child to body absorb calcium and phosphorus from food. Not enough vitamin D make it difficult to maintain proper calcium and phosphorus level in the bone, which can cause the rickets. And some symptoms will show the rickets, for example delayed growth and delayed motor skills, pain in the spine, pelvis and legs, muscle weakness, because rickets softens and the areas of the growing and the tissue and end of the child's bone. It can cause the skeletal deformation such as the bowed legs or knock knees, thigh, wrist and ankles, and breastbone projection. And these are the symptom and signs, and some cause are the here for the rickets here. When your child is need to vitamin D to absorb calcium and phosphorus from the food, rickets can occur in your child. Doctor can recognize your child's body by seeing its skull and deformation of leg and leg position and bones position. And there are the some treatment for cause rickets can be treated within the vitamin D and calcium supplements. Follow the child. Your child doctor will monitor your child progress with X-ray and blood tests. And fourth question is about skin. Primary and second is skin. Primary and secondary skin lesions, and the people with the primary skin lesions are abnormal skin condition present at birth or acquired or over a person as a lifetime. As secondary skin lesions are the result of irritated or manipulated the primary skin lesion. For example, is some scattered on the mole until the bleeds are resulting lesion in the crust in now the secondary skin lesions. These are there are some I will explain about the some type of skin lesions. The primary skin lesions, birthmark are primary skin lesions as the mole and acne. Other types include the following: the blisters. Blisters are the skin lesion filled with a clear fluid. Small blisters measuring less than 1 centimeter in size, also called the vesicles. And there are some this reason for the blister will occur: the sunburn, steam burn, and insect bites, and friction of the shoes and clothes. And second one is the macules. Macules are the small spots that are typically brown, red, and white. They are usually about 1 centimeter in diameter. And next one is the nodules, is a term used to describe the growth of the occur under the skin, such as the certain type of cyst nodules are typically under 2 centimeter. And papule is the raised lesion, and most of the develop with many other papules. And patch of the papules or nodules is called the plague. Plague are common in people with cirrhosis. Pustules are the small lesions filled with the pus, and rashes are the lesions that cover the small large areas skin. And allergic reaction, and common allergic reaction rash occur when a personal touch poison ivy. And wheal is the skin lesion caused by an allergic reaction. And the secondary skin lesions are when the primary lesions are irritated, then they can develop into secondary skin lesion. The most common secondary skin lesion in the crust is the or scabbing increated when the dried blood from stretch and irritate the skins. And second one is the secondary lesion is the scales such as those caused by the actinic keratosis are patches of skin cells and build up and then flake of the skin. And scares next one is scares. Some scratches are cut and crepes will leave the scares of aren't replaced with the healthy normal skin. Instead of the skin return the thick raised scare with the scar is called the keloid. And skin atrophy and ulcer, and there are many type of the secondary skin lesions, but I will explain some important skin lesions because of the video will make is larger. Only Moodle will accept only 20 MB video. That's why I am finishing here my topics about border control. Thank you.